Let me give you a quotation and a fact. The quotation comes from you in Basic Economics. Quote, "A long-standing staple of political rhetoric has been the attempt to keep the prices of medical care reasonable or affordable. Yet the amount of resources required to supply the things we want are wholly independent of what we're willing to pay. It is completely unreasonable to expect reasonable prices." That's the quotation. Here's the fact. The United States devotes 17% of its GDP to healthcare. The next country down in that is Switzerland at about 11% of its GDP. So we devote something like 50% more than the next country down. Now, surely it's not unreasonable to suggest that we're just spending too much.
The question is, when people are spending their own money, I don't know how third parties can say it's too much. Well, ironically, Rahm Emanuel's brother, who's a doctor, has on board for this whole Obamacare thing. But really, he revealed why Americans spend more. Americans don't, when they go to a hospital, they are in private or semi-private rooms more often than in countries on government health care. And so instead of being in a ward, you're in your own private or semi-private room. It costs more. American doctors are more readily available. There is less waiting time. Some people prefer to pay in money and other in waiting time. Now, when you have a painful disease and the government tells you there's a 6-month waiting list, that you're paying in a different way. It doesn't show up in the statistics, but you may not even live the 6 months depending on what you have.
So we pay more and get more.
That's it.
That's it? That's all there is to it?
That's it.
You don't want to say, but at the same time, our system is terribly inefficient in various ways?
No, it's not inefficient for people to buy what they want.
It has to be more complicated than that.
What's inefficient is having third parties decide what you need and don't need. As for example, in Sweden, where and it's not like an insurance company saying they won't pay for it. In Sweden, if they say that you don't need this, you can't pay for it with your own money because they control the whole system. And so your choice at that point is to leave Sweden, which if you're very sick may be a little hard to do, or to have what you need smuggled into you.
Right.